I come from Bulgaria. This is neighbor country to Greece. For those who don't know, I've graduated dentistry many years ago, and later on I decided to study psychology because changes in patient-doctor interaction, this is not my cup of tea anymore. I don't like these changes that happen. And I know that you have same issues in your countries. Patients need more time. They want to talk to their doctors. They need to be treated as individuals, as personalities. My dad was a doctor and my mom was a dentist. So my childhood was between patients. I grew up there. I love my profession. I love my students. I respect my students. So this is the idea to start with this presentation. Who we are. I work in a very small team. I can say that we are not only colleagues, but we are friends. We share together our vacations and free time. Yes, we are a great team. All of us, we are dentists. And we teach in the Department of Dental Public Health. I think it will be better if I stay here. So what is the composition? We have one full professor, 2 associate professors, and 3 senior assistants and 2 assistants. Okay, what is our research focus? Even though we are dentists, we are interested in different areas. And one of my colleagues is, his thesis is about oral health quality, the other one about muscle and skeletal disorders among dentists, job satisfaction, dental practice organization, personality and dental anxiety, and dental services access barriers. I'll send it one by one. Teaching areas. In our department, we offer teaching in medical psychology, social medicine and medical ethics, and the third discipline is dental public health. This is the head of the department, and he is also the dean of our dental school. His name is Bonev, excuse me. He is the dean of the faculty, as I told you, and his dissertation is about oral health and quality of life among individuals over the age of 20 in our country. He was part of a very comprehensive research, epidemiological research, and it was international. And after that, he wrote his dissertation. These 2, you see, we are just friends. You can see it on the picture. Yes. Associated Professor Peter, he wrote a dissertation about muscle and skeletal disorders in dentists related to dental practice. And the other colleague dissertation is about organization of dental practice in market conditions. This is my colleague, Associated Professor Nadia Avramova. She wrote a thesis about dentist job satisfaction. And after my graduation of psychology, I became interested in personality as of dentists, as of patients. And I provided kind of study that was focused on personality traits of patients, the anxiety, and particularly dental anxiety, and what is their effect on dental health. And because there are some psychological characteristics of people under 18, so my focus group were dental patients of people who were over 18. And this is one of the youngest colleagues. He wrote about barriers to accessing dental services and their impact on dental health. What do we teach our students in social medicine and medical ethics, contemporary health concepts? Also, we have research methods, essential skills about scientific literature review, research planning, how to interpret results. Then we have medical ethics, that is very common to Professor Giretto's teaching. And also we have ethical decision-making, because sometimes in our country, usually dentists, they are managers of their own practice. It doesn't matter if it is going to be single practice or bigger facility. And we have to take decisions as people who manage the practice and at the same time as practitioners. Talking about dental public health, the teaching is concentrated on epidemiology and research, how to conduct and analyze dental health studies, community programs associated with planning and evaluating public dental health. Then we have healthcare systems to understand structure and regulation of dental care, and we have practice management associated to ergonomics, risk management, design of the clinics, and so on. Medical psychology, we have psychological development. I mean psychological development during childhood and adolescence period. Then we teach students how to analyze patient behavior. We teach them about psychological profile of dental profession, then anxiety and dental phobia, and communication in dental practice. These are the main modules during the training or in our education on medical psychology. Okay. Why did I put these 3 drops coming down? Because medical psychology, social medicine, and medical ethics, they go to the small lake of patient-centered dental care. Patient-centered dental care is today the main approach that we apply or that we use as in dentistry, as in medicine. Patient is in the center. And we apply the so-called biopsychosocial approach because the disease or medical condition, they don't affect only the body, because body and mind, they work together, and we are not alone in this universe, but we are surrounded by some social factors. So for that reason, we apply this 3-dimensional biopsychosocial approach in dental medicine. What we have in mind here, that there are psychological factors that are addressing personality traits affecting treatment of the disease. We have patient-centered dental care and medical care, of course. We have different type of personalities because as the patient is unique, as the doctor is unique, and sometimes we cannot cooperate. As in our daily dental life, sometimes have this happen to you? You meet somebody for the very first time. You don't know them, but you don't like them. You share different values, you share different frequencies. This happened to all of us. So it's the same in medicine, but we are not allowed to be emotional because we must behave professionally. Personalities or differences between personalities might be the beginning of interpersonal conflicts, as between team members, as between doctor and patient. So we discuss such topics during education or training, especially in social medicine and in medical ethics. Social environment is extremely important because, as Hippocrates, the Greek person, the godfather of medicine, said that the disease is hidden not only in microorganisms or in the body, but also how people live. Disease context, it means understanding illness or medical condition beyond clinical symptoms. And these are some rapidly coming pictures. This was the rapid development in my profession. I still remember what were the conditions and the equipment my mom worked. It was around 45, 50 years ago. And for 50 years, we have high-speed development in dentistry. Modern equipment, we have scanning, 3D printing, artificial intellect, everything. What will become, this is in my opinion, everlasting, this is communication between human beings in dentistry and in medicine. I'm going to clip it back. It's okay. Excuse me. So You see, implants, autoclaving, 3D printing, everything. But still human beings are going to treat or to take care of human being. For that reason, I had an idea and I shared it with my colleagues, and I'm very, very happy, as I told you, to work in such a good team, that we have to focus on soft skills. And essential soft skills that we were concentrated on were core understanding and protocol adherence. I'm going to explain now. This is history taking information. There are big gaps. This is international problem because doctors don't have time. They just ask some basic questions when they take the medical history. They skip asking some very important questions. They skip asking, what's your profession? Or what's your rhythm of work? Where do you work? Are there some hazardous conditions? Do you work during the night or during the day? Because they have impact. Doctors don't have time to sit. They communicate with patients in a standing position as if they are superior, and patients know that they don't have time. But I train my students, I say, just sit, share same eye level with your patients. It means that you're equal, you're partners, and they're going to be a bit less anxious, probably. So communication, empathy. Empathy is not to like or dislike, but just to understand and accept people the way they are. Teamwork, because doctors are part of a big team. And adaptability, just to adjust to the new technologies and staying calm during unexpected situations, as my colleague said. There is a term in medicine and in dentistry, and it is rapport. Rapport means that we have to develop trust. Patients feel assured of ethical care. We have to develop respect and to achieve it. This is mutual respect, enhances communication. Here we have empathy, recognizing patient emotions appropriately, and communication. Use clear language and encouraging questions. I don't know if you have ever been patients, but sometimes doctors use terms and we don't understand them, because even if we have spent hours of browsing and reading on internet, we are not experts. We imagine things sometimes in a wrong way. So we need clarification, and use of terms is not very how to say, a positive as a behavior. What did we do? We organized a voluntary course. I'm very happy because we have voluntary students for 3 years. Each year they wrote their application, they texted us, and these students, they passed kind of training. What did we do? They had seminars, they have some assignments to do at home. We gave them some information to read, but because they were part of this kind of small project, we provided a personality assessment of their personalities as future dentists, of the students that took participation. And I used 2 types of psychological tests. The first one is Hans Eysenck, is very famous, and the second one, this is a French scientist, Berger is his name, and he developed a questionnaire inventory about how to assess the temperament of people. Then we had these seminars and practicals and assignments and so on. And we have role-playing exercises. The last meeting, the last session of this training was the following. We paid, of course, of professional actors. They came to the dental school, and the students had no idea that these are professional actors. And we provided video recorded role-playing exercise, and these actors, they presented 3 types of personality: cooperative type of personality, anxious, and aggressive. I mean aggressive, they didn't fight, but there are some patients or people who are annoying. They start explaining, they know everything, or their body language is neglecting, and they start browsing in front of the dentist. So this is aggressive behavior. And it was very interesting because we provided video recording. They had specific dental case. They were informed about the dental case, but they have no idea that they're gonna meet an actor and how this person is going to behave. And it was really a surprise. Then after this recording, we met all the students and we watched the videos. It was great fun. They laughed. And we discussed each video, what kind of mistakes they did and what were the right moments of their behavior of the students. Okay. And they had written tests, of course, in order to be assessed if they acquired theoretical knowledge. So what were the main points or the main moments that we have accessed when we watched these videos? This is the initial engagement or professional verbal greeting. Still in my country, it's a manner of good behavior when the doctor shakes your hand. Because I teach some foreign, not some, but a lot of foreign students, I ask them, how is in your country? Do the doctors share your hand when say hi, when you enter the dental office? They said no, usually no. It depends, it's culturally sensitive. But still in my country, this is manner of respect. Then we have non-verbal communication. This is the position of the body. Position of the body means that doctors do not cross their legs, do not cross their arms, because this way I build a barrier between you and me. I cross my body, I'm not opened. And also, as I told you, we assessed equal level eye contact. When the patient is in a sitting or reclining position and the doctor is standing, you see, we share different eye level. We don't have equal eye contact. And the hidden message is, I'm the superior, I'm the dominant one. And it is counted as kind of mistake. Number 3, facial expressiveness. We all know that we have to control the so-called cross-infection between patient-doctor, patient-patient, and we put masks. But I browsed in the scientific literature and I found out that patients prefer, not during the treatment, but when they communicate, interact, or when they discuss something with their doctor, the dentist or the doctor, to be with masks off. And clever people develop these transparent masks. They are called communicators. Yes, great idea, because you have to know that communication is comprehensive when we see facial expression, facial muscles, we see gestures and everything else. So the next one about assessment criteria was gestures and body language, because over-gesturing is not good. Then the use of professional language. Sometimes it is recommended, not sometimes, but it is recommended the minimal use of jargon or professional slang words. As I told you, patients feel uncertain, more anxious because they don't understand, because health is very, very sensitive area in our life, because of survival instinct, mainly, not only, but mainly. So when we use professional terms or language and then we do not clarify what we mean, they feel, let's say, uncomfortable. Then, collaborative team planning. It means what we assessed is, in the end of this role with the actors, we assessed, did the actor or the patient, did they agree with the treatment plan, or they start hesitating, okay, doctor, I'll think about it, I'll come back, or they rejected the treatment plan that was offered to them. It was really very interesting. Yes, these are some of the students. They put masks because this was just after the COVID period. This was the first session we provided, and this is the team. You know, these are the professional actors. It was great fun. They enjoyed the idea, and I'm very happy because we developed the idea of soft skills training, and now we organize an international project about soft skills with 5 partners from other countries. I do hope. What is the idea? The idea is to implement artificial intelligence because, as my colleague said, during our professional life, we fall in different situations, and there is no strict protocol how to behave. We have to be flexible because there is different personality, age, they are competent or not. Some of them are under the influence of substances, conscious, unconscious, and it takes time to train yourself to become a good professional. The idea is to develop personality by the help of artificial intelligence, kind of people, you know, computer people, and they are going to be patients, and this way we're gonna help students to train themselves how to take in details medical history information and not to skip some very basic and important steps that are associated to a treatment plan and medical history taking and social associated information. I hope it will work. And this way, after their graduation, even theoretically, or even by computer or artificial intelligence, they probably might be better trained. What is the improvement and implementation of soft skills? What will be the benefits? Anxiety reduction, patient satisfaction will increase, and it will increase because it was found out and proved that patients are more satisfied when they are less anxious. Patients' trust. Then we have health-related behavior, minimum conflicts, and less psychological stress for the dentist. Okay, so these are the benefits of soft skills improvement and implementation. Some days ago, I've watched a movie. I didn't know about that movie. It is 10 years old movie, and the name is Transcendence, and it is about artificial intelligence. It was full with very famous actors there. I had no idea, and in the end of this movie, I was ready with a presentation, but I edited it because I watched the movie, and one of the characters talked to the other one the following: I spent my life trying to reduce the brain to a series of electrical impulses, and I failed. Human emotion, it can contain illogical conflicts. We can love somebody and yet hate the things that they've done, and machine can't recognize this. So this is my big question mark. Is artificial intelligence going to work efficiently to achieve my goal and to train students the way we want to be treated, to be ready for every single different situation? Because human beings are unique, and emotional system and emotions make us so very, very different and much more unique. So, thank you for your attention. And this is my team. This is a picture in the official website of the dental school, because if you enjoy your job, actually you don't go to work. Thank you very much.
Thank you very much. Does anybody have a question? Comment?
You know, it's really interesting, and we started using the word power skills instead of soft skills. Just interesting.
Actually, the official term is soft skills because skills are divided in medicine and in dentistry to two main groups: technical skills. Hard skills are technical, you know, these manual skills, how to drill, how to prepare, how to fix things, and soft skills. Honestly speaking, I don't like it, and in my language, it doesn't. This soft skill term doesn't bring the actual power of the soft skills. Yes, so you're right, but you know that sometimes we have to keep official terminology.
Yeah, no, it's just curious. It was just recently we had an industry partner in, and I would do that work, and she said to me, it's power skills. I'm just sharing with you. I didn't necessarily agree with her in one.
I'm going to write an article why it should be power skill but not soft. Thank you. You gave me an idea.
There you go.
Okay. Can I write you as a co-author? Thank you.
Yeah.
Thank you very much.